today for another episode of the ALG Weekly. And before we start today, we have Mr. Papaja, who has been promoted as our executive director, and is going to play us some music, and we'll go listen to African music.
I've been fired, but I am taking everybody to Sierra Leone. And Abdul, you can tell us a little bit about this song. Who's the singer? What's it about? Being from Sierra Leone.
Who's the singer, Mr. Abdul?
I don't know who's the singer, but what I can say is that it's practically talking about the new government that we have in Sierra Leone, and how they are doing, and people are still. They're saying that we are not going to get tired of complaining about what's going on, So.
All right, another great music from another great African country, Sierra Leone. If you're joining us today I have the honor of being joined by two amazing people. We have Mr. Abdul, who's the chairman of the ALG Health and Wellness Committee, and we have Mr. Sharma, who's also a member of the ALG Health and Wellness Committee. Before starting, Mr. Abdul, I'll just have you introduce yourself to our community and our people who are watching us right now.
Hello, everybody. It's a beautiful day. We thank God for an opportunity that we have to be able to introduce ourselves to you. And as a member of the African Leadership Group, Health and Wellness Committee, I'm the chairperson for that group of people that our main focus practically is to concerns the health and wellness of the community members, immigrants, no matter where you're coming from, whether you're from Asia or you're from Africa, wherever you're coming from, or Europe, wherever you're coming from. But our concern practically is for the health and wellness of community members.
Thank you. Mr. Sharma, you are also a member of that committee. So if you would just introduce yourself and tell us a little bit about yourself.
Yes, I'm Dr. Sharma Moussata, but I prefer to go by Sharma because that way I relate more to everyone. And thank you for the opportunity again to be able to speak to the community. I do care a lot about our community in the sense that as a community we still have a lot to do to integrate the American way of living and for our voices to be represented in a healthcare system and clinical research. And so for this moment, I just want to take the opportunity to say ALG is doing a wonderful work, and we are all supporting ALG, and I'm calling on the leaders of each African community, each African country here in the Denver area, to come together to support each other's, regardless of our missions. But when it comes to health, we all are facing the same issues. So we can come together to discuss the common things that we're facing in our communities and to come as one united to be able to have our voice be heard during the health policies that the state of Colorado is implementing, because those policies affect all of us. Yes. When we're not included, we feel the impact of those, but we are not represented, which is not.
Yes. Thank you to the both of you. You touched on something that is very important. We'll come back to it later. But when we say health and wellness, and then we talk about African immigrants, what does that entail? Is there any particularity when it comes to our community and our health?
Well, it has to deal with the whole area of how our community being able to be involved in the health of in their own health. As such, we have recognized that many communities have been left out, and many communities are not aware of all the changes that is going on around regarding their health. We also recognize that there are many communities that are afraid because maybe they don't have their papers and things like that. They are afraid to go to the hospital, or some of them are afraid to do the things that are supposed to help them to be healthy, around.
Mr. Sharma, you are a doctor, you do practice, and I guess that in your day-to-day life, you do encounter a lot of our community members who are coming to you and are going in there. So as somebody who is in the health and who is in the field of healthcare, if somebody was to ask you, is there a need for a committee like this in our organizations and for the African immigrant community? Is there a need for that?
I have to make a correction or rectification there first. I am doctor in healthcare management and leadership, who's interested in health disparities and research overall involving minorities. I'm not a practicing medical doctor. So I just want to make that correction first. Yes, when it comes to health, my understanding of health is that without health, regardless of your racial or ethnic background, as a human being, you have to be healthy to do anything you can do or you want to do in life. And when it comes to the minority communities, especially like ours in African immigrant communities, we do have the most diverse genetic pool of all the subpopulation of the United States. But if you look at how the health research is conducted or clinical trials are made, the African community, which is more diverse genetically, is not included. What it means is that when the drugs comes out or vaccine comes out, the other people have tested on the people, so they know it's going to work. But we have no guarantee that the vaccine or the drug that's been developed, because we were not part of the research, it's going to work on us. Well, the question becomes, we all feel that we don't want to be guinea pigs. There are historical reasons why we resist participating in this research. They are valid reasons. But however, we cannot be staying on the sidelines and going to the doctors, getting the medicine that have not been proven to work for us. So the only way is to build bridges or collaboration between healthcare organizations and pharmaceutical companies to make sure that when they design the research protocols, our people, our voice, with the diversity we bring in, ethnically or genetically or even linguistically, are included in those studies. That way, we can also, the manifestation of the disease can be accounted for within how it manifests in the African immigrant population.
Thank you. And I think he talked about something that's important, which is the building of bridges, which is something that we value here at the African Leadership Group. As the chair of the committee, what has your committee done to build bridges, and especially in the era of COVID-19, to make sure that our community is getting the information that they need, but also the resources that they need?
Well, one of the things that we have done, we've been able to get COVID-19 tests here. We were able to get a lot of, in collaboration with Stride, we were able to get COVID-19 tests right here in our offices here. And we were able to send it out so everybody would be aware of it. And we had a lot of people that came in to have COVID-19 tests. And we intend to continue on collaborating with different health organizations and groups and hospitals so that we can be able to bring them here and they can be able to attend to our communities.
Thank you, Abdul. Sharma, I'll come back to you. You talked about research, and we just talked about COVID-19. And as we're hearing, there is some report coming out that there is a lot of hope in the development of a COVID-19 vaccine. And you just talked about the difference when it comes to the research and our community not being part of that research. Is there anything that has been done that gives you hope that as far as it goes with this COVID-19, that there are members of not just the African diaspora, but even the Africans in the continent who were part of this research, and that this research will also, if it comes out to be true, that the vaccine will also be working for members of our community?
You just touched a very critical point of interest to me. That's what keeps me awake at night and thinking, and also reaching out to some of the executive leaders in companies like Eli Lilly, where I discussed with the vice president of Eli Lilly, asking him the question I wanted to know, when we say the minorities, African Americans have been included in the sample study. I wanted to know, when the research showed that about 5% of black people participate in clinical research, the questions that I don't know the answer, nobody knows the answer until today, is within that 5% of black people, what is the percentage of African immigrants? Okay. The research has shown that the like I said, the diversity of the genetic pool of Africa is so diverse. And when you and I have left Africa, we come to the United States, our body adjusts, our DNA adjusts based on the environment where we're living in.
Mm-hmm.
Okay? And so when we are not included in the research, those transitions that we are facing, how the disease will manifest in us, is different from an African American who has been here for more than 100 years. So it is okay to lump everyone in within the African American, but me as someone who comes from Africa, I was ask a question: what's the representation? What's the true value of African immigrant within that? And you talk about collaboration, building bridges. That's why I'm working. I'm also a member of the Black Colorado Black Health Collaborative, and that's why we were able to also work together to bring the flu vaccine to ALG, because there are studies that have never been done, but we have members of the communities. We have to do those studies. For example, like you mentioned, is our perception or beliefs of COVID, or are they the same like the African Americans? We know that our lifestyles, way of living, are different.
Yeah. And thank you. So as we are talking about the COVID, although hopes are going up that we may find a vaccine, but there may be some time out. It's been more about a year that the COVID has been around. As far as the things that we are in command of, the things that we can control as a community, what message do you have for our community, especially now that we see that cases are rising, especially in our state, the state of Colorado? What are those things that we can do ourselves to make sure that our COVID, that we are limiting our exposure to the COVID-19?
Well, we do have a lot of comments and situations that came up regarding in our cities, various cities in Colorado, wherein we've been advised to continue on doing what we've been doing, washing of hands, and we will continue to encourage our community members to please continue to wash hands frequently, and also don't forget your mask. Your masks are very, very, very important, and the 6 feet and all of those kind of things. Distance is very, very important too, especially if now that we are seeing a rise in COVID-19 in the various cities that we comprise of, So we have to continue to obey the rules and the regulations that the city government, our state government have instituted, especially most recently encouraging everybody to continue to wear masks and keeping your distance, and even coming regarding these holidays coming up, they're encouraging that if you are planning to have a big occasion with family members, please restrict that, be with people that you are living in the same house, for now,
And thank you. Sharma, we just talked about the COVID-19, but there is also something, we are now in what we can call the flu season, right? Mm-hmm. The COVID-19 has killed about 250,000 Americans, but the flu also in 2018, or all these years, kills about tens of thousands. In 2018, I think we had close to 40,000 Americans who die because of the flu. Is there any correlation in between the two as far as research goes? And also, having the two at the same time, does that put people more at risk?
Okay, we're speaking to the community here,
Yes.
but I don't want to go too much into the details. As someone who comes from the pharmaceutical industry with 14 years of experience working in research and development, you asked the question about are they going to do anything, the vaccine going to be found? I do trust that pharmaceutical companies, as businesses, they see this as an opportunity to find a vaccine because that's where the money will be. So they're doing all the research. Where I'm a little bit reluctant or not trusting is how the process of making a vaccine has been accelerated. It takes normally, for the vaccines we have, above 4 years to do the research thoroughly and to make sure that it works. But we have been going through at a fast speed that doesn't allow regulatory agencies like FDA to do all it needs to approve that thing. Yes, the pharmaceutical companies are doing their part, but I don't think that the data that those companies are generating has been verified, has been to the public, so they can other researchers in the university can do to make sure that yes, we're getting the same result. Our results corroborate or support your findings. That has not been happening yet. And in that point also, from the standpoint of our communities, what I will say is that while we hear the news that the vaccine is coming out, Pfizer just announced today that the COVID vaccine will be able to protect you 90%. If you're going to be protected against the COVID. Yes, that information is internal information, research coming from a pharmaceutical company. But in the research, other entities have to verify those claims, and the FDA have to have the time to make sure they verify that claim before they approve it. Okay. When it comes to our communities, the correlation between the flu and the COVID, yes, there's a correlation. If you go back to the pandemic of 1918, the COVID is just a different forms of the involvement of the same flu, but in different ways. There's some strands that went through animals, and some that took the path of humans, and then they came and found themselves together again to create what we're facing today as a COVID. But in terms of the research, it's something new. Nobody has the solution. Nobody knows. For you to be able to do a research on a virus and understand its behavior, it takes a long time. So to the communities, what I'm saying is I'm encouraging everyone with the flu season being here, take your flu shot. That way, if you have any manifestation of anything, you can be at peace or some assurance that I have my flu. So we can begin to say, it may not be the flu. Okay? So you have a possibility to eliminate one thing. If you have not taken your flu shot, the question becomes now, where do we start? So it's important that everyone comes out to take the flu shot.
Yes, thank you. And you know, he talked about our communities going out and taking their flu shot, but we also know that there is a lack of resources within our communities that has become apparent in the age of COVID-19, where we've seen Black and brown communities across the United States being affected disproportionately. Now that we are in the flu season, what are organizations like the African Leadership Group, and especially the community that you're leading, what are things that we should do to make sure that flu shots are available to our community, and what are those things that we're doing to make them available?
Well, we want to really thank our brother, Dr. Sharma, here for interacting with various groups like the Centura Health and the Colorado Black Health collaboratives bringing us all together to be able to give us some flu shot. As we did the last flu season, we were able to get a health organization to bring out our flu shot here in our community, and provide flu shot in our community. And that is exactly what we will be doing also, with collaboration with the Centura Health, Colorado Black Health Collaboratives. We are able to offer flu shots to community members on Saturday, November 14th, beginning from 9 a.m. to 1 p.m. We do recognize that the place might be a little bit cold depending on the weather, but everything will be done according to the COVID-19 restrictions. Temperature check, and as well as the 6 feet distances, and everything will be done according to the regulations that have been given to us for COVID-19. So we are encouraging everybody, please come out on Saturday, beginning at 9 o'clock to 1 p.m. We have a lot of batches of flu shot to be able to give out to people.
Thank you. So as you heard it, Abdul just said it. That's what we do. We make sure that our community gets the resources that they need to get. And so it is going to be this Saturday from 9 to 1 p.m. and it's going to be at the African Leadership Group Center. And if you don't have the address or you need more information on this flu shot, you can go to our website. It's www.usalg.org. Sharma, I will just come back to you as we go on through this discussion. You just talked about the process of elimination. That is, if you do take the flu shot, then we do know that this won't happen to you, or that we do know if something comes to happen to you, that this is going to happen. But knowing our community and knowing that our members do not have that much trust in a lot of systems, what would you say to somebody who maybe doesn't trust the medical system and would say, why would I go and take a flu shot?
That's another point you just touched that drives me keep me going. It's how do we build the trust of our community members? This is an issue with all of us Black, regardless of your country of origin, those from South America, Africa, and those are here, African American, is the same issue. Like I said before, for several historical reasons, one of them being the experiment of Tuskegee that everyone has heard, it's we do not trust healthcare institutions or research because of what they have done in the past. With that perspective in mind, it's also important for us to bring to the awareness of healthcare organizational research institutions about the role, the significance, and importance of cultural competency in their work. And that's the work that my group at the Clinical Trust Solutions, that's what we're doing, is going to these health and research institutions to try to educate them that your business is to serve the people. Whatever you create is for the people. So your business, it will be a sustainable strategy to serve everybody. That's how you're going to stay in business. And therefore, to serve people appropriately, you have to know their beliefs, you have to know their cultural values, you have to know their preferences, and it's only through that you can design things with that in mind that will be able to serve those group of people. And that has not been happening with the Black community overall. And so we want to change that perspective. Instead of allowing other people to continue to write the view of Black people, we want to be involved in the research, generating data, missing data for African immigrant populations. And also I'm encouraging everyone to say that in terms of the research, or health professions, there are a lot of opportunities. We're also encouraging hospitals and research, especially at the university level, to be able to reach out to African immigrants. We have qualified people. Go to those communities when they have the event. Get to meet them, and allow us to have access to job offers that you have. Help us to run them in our communities. And also another thing we need to do on our side is to make sure that we get a lot of people involved in research.
Yes, thank you so much. So you talked about two things that are really important, which is beliefs and values, and people being able to build trust with those people who are there to serve them. As community leaders, we know part of building that trust is also people seeing the people who are serving them, people who look like them, who know what they've been through and who they are. So what are those steps that we can take to make sure that more members of our community are integrating the healthcare system, but also that they're integrating the healthcare system at a level where they are able to serve our community members, so that we can build that trust?
Yeah, I think it comes to the whole aspect of us going to our different families and encouraging our different families to participate. Participate in the organization's attempt to create a very good and health care system, kind of system, in our communities. So it's like me going to my family and trying to make sure that my families participate in the healthcare things that we are bringing up, and you going to your family, everybody going to the different families that they have and trying to tell them about this. It's like spreading the news. I think that will help a lot if we're able to spread the news. And one thing I forgot to say is that this flu shot that we're having on Saturday is free. It's free flu shot, and we really thank God for that. And we'll have the opportunity of having a free flu shot. So please don't forget about it. Come out on Saturday, beginning from 9 o'clock to 1 p.m., Saturday, November 14th. We are going to have free flu shot right here at 700 East Evans Avenue. That's in Aurora, Colorado.
Yes, thank you. And as you heard, it's the difference that each one of us can make. It's that personal difference, the fact of whether you just pick up the phone, call people, make sure that they know about what's going on as far as health goes. So talking about spreading news and the power that people have to impact their own health and the health of their community. We just came out of the election. Was there anything on the ballot, especially here in Colorado, that would in any way impact the healthcare system?
That's a good question. I don't have on the top of my head which one will relate more. But what I know is that the going to vote, the turning out to go vote, has implications on the health care that we receive. The more we vote, the more our voices are included, the more those voices change or have an impact on the health policies that the state create. And therefore, the hospitals and also research institutions have to pay attention to those policies to be able to target the population they're working with. And one thing I want to add or speak clearly to the community members about the vaccine. I just have an illustration I want to share is maybe that will help people, to encourage people to go take the flu shot or take the vaccines at all. Look at the vaccines this way. First, let's look at the virus this way. Let's say COVID. Let's assume that COVID is a person, okay? And that person, he knows that if I go to Papa's house, Papa is going to recognize me if I go as I am. So what the virus will do is, in Papa's house, it shows up as a head. And in Abdul's house, it shows up as the leg. And in my house, it's going to show up like an arm. And in somebody's house, it shows up as an eye. in another person's family is the nose. Well, just with one piece of that information, you cannot tell what is it. But with the vaccine, which is an element of, I'm talking now about vaccine in general, that are DNA composed. It's a piece of the DNA that put into your body, a piece of the DNA of the virus. Well, the piece of DNA, once you have it, then the piece of DNA in your heart say, hey, I know that head. That head belongs to that person. So that's what the vaccine does in your body, is through the DNA, it recognizes whatever form the virus is hiding. That's a DNA for this virus. I know it. I've seen it before. But now the COVID vaccine is different because it's using an RNA, but the principle is the same. So would you rather have that piece of the information in your body for every member in your family, so that when you get that virus, that can help to say, hey, you don't need to get to this body already because we're here. We are your friends. You keep looking. So that's the illustration I want to share with the community members, that please, that's the best I can come to try to clarify the importance and significance of getting the flu shot. Or whatever vaccine you need to be taking, take them for that reason. It is not, I understand, you can get the flu shot or COVID shot and still get sick. The reason, there are several reasons. You may be already infected before you get your shot. Okay? Or you may be having other underlying medical conditions that made it that the shot didn't work at all. But it is a good idea to go get your flu shot.
Thank you.
Please come to the flu shot, to the clinic, and receive your flu shot. Like Abdul said, it is free. I know we have a problem with hearing the word free, and we always give, what is the catch? The catch, here is what I'll say about the catch. We all pay taxes in America. The other programs, the money that we don't receive back in taxes in a different way, but it comes to you in forms of policies that are being impacted at the federal level, implemented at the federal level and the state level. That's another way of you claiming those things. And the government, the medical institution and research institution, they know they have this trouble reaching out to minorities. So what is the catch there is that resources that understand that, yes, those communities have to access to some of these resources.
Yes, thank you. He talked about something that was really important, which is the underlying health. So, and we saw that the reason why COVID-19 has such a disproportionate impact on Black and Brown communities was because of some of those underlyings. So there is something such as diabetes and mental health issues that we see in our community. So, like, above or aside from the COVID-19 health, we have always experienced health and wellness and health disparities in our Black and Brown communities. So if we were to go past COVID-19, and hopefully we do soon, what are the steps that we can take to make sure that those health disparities and that the health gap doesn't grow?
I think we should continue to have collaborations with various groups. That's very, very important, and we should continue to have, for example, we're going to be having collaborations with the healthcare workers in our communities. We're going to bring them together in January, sometime in January. We're going to bring them together. We all sit down and talk about the health and wellness of community members as such, I think so. Collaboration. That's what I will emphasize. But going back to one of the questions that he asked after the election, there was something in our ballot, measures that was taken, that was approved actually by overwhelmingly approved. That is the aspect of the having paid Proposition 118, the paid medical and family leave.
Oh, yes.
That's a very, very important aspect. We do recognize that when someone is pregnant or having a child, both sides, whether it's the husband or the wife, when they have a child, usually it takes them a few days and then they're back at work. As such, and that was overwhelmingly approved. So that's one of the key medical things, healthcare things that was approved in the state of Colorado.
Yes. That's thank you, Abdul, for bringing that up. That's very important, and it is up to us as an organization to inform and educate and empower our community members with the resources, the tools, and information they need so they can make the appropriate decision to help their loved ones. That's law. What it tells you, you have to know that unlike like before, today, now you can make a responsible decision with your wife, depending on what is happening to your family. You can choose to say, hey, we're going to use this because I want to take care of my wife. You can have to, and you should not be afraid of your work. That's a great achievement. That's very important. And the other thing I want to mention about the next step you said, in regard to COVID, as everyone I know, we're going to say they can approve COVID. So what we are doing, I think ALG would know, is we've been going around and making sure that we know all the potential sites where the COVID research clinical trials are going to be done, and if the vaccines are approved, and we're working to make sure that we get a list of all the healthcare organizations or the research institutions or the universities, and to make sure that we can make that information available to our people. So the next step will be to how do we get together as the African diaspora community, prepare our people to know that when the time comes, we'll have all the information and resources available to share with the people.
Yes, thank you. And if you're watching us and you work in the healthcare system, our doors are open. Please come and work with us so that we can provide better resources to our community members. We talked a lot about the flu shot that's coming next Saturday, and we'll talk more about that. But in the coming year, what are some of the other things that your committee is working on, and some of the things that you look forward to bringing to the community?
Okay, we are really looking forward to the whole aspect of collaborating with healthcare workers. I missed up the date, but on March 28th, we're going to have a workshop with healthcare workers. Well, we're going to tell you where it's going to take place, but that's one of the things that we're going to be having. And then in April, we're going to start talking about post-COVID, mental health situations, post-COVID mental health. I think we all believe that this COVID has really affected the mental health of many people. Sometimes being locked up, sitting up at home, for those few months that we are kept at home, created a lot of mental issues for many people too, So we want to start talking about all of those kind of things. That's in April 1st. We believe that we're going to do that. We're going to work on that. And then in July is usually taken in Colorado as the mental health month. We do want to have programs also during that month that we emphasize a lot on the mental health of people. Of course, you don't forget about African Impact coming up, right? That's in August. African Impact in August. And then finally, we're going to have ALG 9 Health collaboration that we are planning to have that Saturday, October 2nd into 2021. We do want to have a collaboration with 9 Health to create a health fair, for the community.
Yes, thank you, Abdul. Sharma, I will just come back to you before we close here. I know that you're a big part of putting this flu shot together. What are some of the organizations that ALG is working with to put this flu shot together?
The different organizations. It's kind of hard to talk ahead when they haven't you haven't gotten any approval yet. One of the organizations that I'm trying to work hard to get into to know, see what are the different programs they have that we can tap on is Kaiser. As you know, Kaiser as a health network is very closed. It's very independent. It does things its own way, unlike Centura Health and UC Health. And so, yes, the UC Health is one of the network. Centura Health is one of them. And also Kaiser, like I've said, there are a lot of Africans who work at Kaiser, but I haven't been able to get in touch with them. So here it's a call to my fellow health professionals within the African community is please, regardless of whatever you do, and I see everyone in the healthcare as a leader, you have a role to play in the community, and so let's come together and work and help to give access to our members to health care, to research opportunities. When I say research, I'm thinking in terms of the research that target the problems that our community face. Let's identify those problems. Let's identify the researchers who want to work with us through community-based participatory research, where we are involved in the protocol design, we're involved in carrying the studies itself within our communities, and that will have an impact, and that also will give exposure to our community to bring that collaboration we're seeking.
Yes, thank you. And that's a call to collaboration that I myself will second. We are open to working with everybody who wants to provide resources to our community. And I just want to thank the organizations that we've worked with in the past. I know we worked with Stride to provide COVID-19 tests a while ago. But we have come to the end of our show today, so I will just come back to you. Your last word and what message do you have for our community, and also remind them of the flu shot that we have coming up this Saturday.
Okay, thank you all of you that are listening to us and watching on Facebook and YouTube at this time. We thank every one of you for participating in this. I also thank ALG for giving us the opportunity to be able to talk a little bit about the flu shot coming up on Saturday, November 14, beginning at 9 a.m. To 1 p.m. As we are saying, it's a free flu shot, and we are encouraging everyone to come out and have a flu shot. Flu shot is very, very important to us, for us all to have, to help us out in this flu season, because we are currently in the flu season. So we are really encouraging all of you to come in and be part of this flu shot, free flu shot that we are offering. 9 a.m. to 1 p.m. It's free, and we're going to be going strictly according to all the COVID-19 restrictions. Come with your mask and make sure we're going to be taking your temperature before you go in there. Okay? Thank you.
Thank you, Abdul. Sharma, what is your last word?
My last word is, let me first share this. I have my mother-in-law came stay in to be with us here since October the 5th. To October the 29th, she stayed in a hospital. So I'm speaking this from a personal experience that it is the time of COVID is really hard. And talking about mental health, it's creating a lot of stress in the families. And with the case of my mother-in-law, it's not guaranteed that the flu shot to protect for everything. But I'm grateful she had all her vaccines, and before this happens, and so we were able to focus on what was her issue, which is congestive heart failure, if we do not have that understanding, she has all her vaccine covered, everything covered, it will be harder to know exactly what to do. And therefore, I'm saying, please, 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 drive your husband, bring the kids to the flu shot and clinic and have your shot. And especially for those, it is free for those who don't have insurance. You don't have to worry about having insurance. Just come on and get your shot. And we are glad to have these opportunities. And we want everyone to show up in the sense that if our turnout is great, that gives us more leverage to go back to this health organization to say the last time was successful, let's do another one. And so it put us in a very empowering position.
Thank you.
This is one more thing I should mention. Please, if you go to the mosque or you are a Muslim, please don't forget to inform your imams as well as those people that you fellowship with. Please inform them. If you go to church, you go to your churches, please call them up and inform them about the flu shot that we're having, free flu shot that we're having on Saturday.
Thank you, Abdul. Thank you, Sharma. It was a pleasure having you both here today. So as you heard, it is going to be this Saturday, November the 14th. We have a free flu shot. Again, this is a free flu shot, whether you have an insurance or not. Please come, everybody is welcome. Also, if you're worried about catching COVID-19, we here at the African Leadership Group Center, we are following the CDC rules and guidelines. So everybody will be 6 feet apart. We will take your temperature. We will take your pulse before you get in. So there is no COVID-19 exposure, as we like to joke. This is a COVID-19 free environment here at the African Leadership Group. But also on November 16th, which is Monday, the next Monday, we do have our monthly legal clinic, and this will be the last legal clinic of the 2020 year. So if you do have any legal issues or know of somebody who have legal issues and could take advantage of this, please let them know that we do have this. Again, make sure that you spread the word around the community. That is your power. That's the power we have. Pick up the phone, call somebody, share the post on Facebook, share it on social media, and make sure that our community comes out and takes advantage of this free flu shot. Again, it is Saturday, November 14th, here at the African Leadership Group Center from 9 a.m. to 1 p.m. Thank you all, and we'll see you next Monday.
Thank you.